Assalamualaikum everyone. We are from Group 6 and we will be presenting about oral health in athletes. So, my name is RAFEI bin Muhammad SOFI. My team comprises of myself, RIFA AQILAH binti ROSLI, HAZIRAH binti Abu Bakar, ROZANA SHAHIRAH binti RAMLE, and DINIE AMIRAH binti MOHAMMAD KAMALLUDDIN KAMIL. So, Messi and Usain Bolt are examples of successful athletes that people often look up to. They also often give inspiration to people from all around the world. Therefore, there is no doubt that the first thing people would notice is their teeth. Athletes' lifestyle may differ from non-athletes in aspect of their dietary intake, their training, and their exposure to pressure and stress from society. Recent studies of professional athletes' dental health reveal that they have a higher risk of dental caries and erosion. But what are the factors affecting athletes' oral health? Well, other factors that could also affect an athlete's oral health are eating disorders, nutritional challenges, stress and anxiety, poor oral hygiene, and dental trauma. On that count, this case report aims to study factors that affect oral health in athletes and ways that the athletes can manage them. Harmful habits and nutritional deficiencies that often accompany disordered eating can have severe consequences on an athlete's dental health. Food restriction often leads to nutritional deficiencies, and it can affect female athletes more often than males. Young male and female athletes tend to be at a greater risk if they play sports that focus on personal performance, appearance, diet, and weight requirements. Three risk factors are thought to particularly contribute to a female athlete's vulnerability to developing and eating disorders, which are social influences emphasizing thinness, performance anxiety, and negative self-appraisal of athletic achievement. Next is nutritional challenges. Frequent carbohydrate intake and prolonged exposure of the teeth to dietary carbohydrates generates an acidic plaque environment, which promotes the demineralization of the dental enamel, causing dental caries. Acidic sports drinks also cause dental erosion because these sports drinks, many of these are based on acidic fruits that may contribute to erosion. Rinsing your mouth with sports drinks or intra-workout supplements also increases exposure time and therefore increases the risk of erosion. Research indicates that athletes with higher training volumes have an increased risk of dental caries or erosion due to their more frequent consumption of food or fluids that may potentially damage teeth. Chilled drinks will cause less erosion than those at room temperature. Many athletes struggle with stress and anxiety on a daily basis, and they each react with it differently. Stress can affect oral health in many ways, including bruxism, temporomandibular disorder, periodontal diseases, and canker sores. Anxiety and stress also play an important role in causing xerostomia. Xerostomia can lead to markedly increased dental caries, parotid gland enlargement, inflammation, and fissuring of the lips. These competitive athletes have unique vulnerabilities to mental health challenges such as anxiety, depression, and bipolar. Elite athletes, they have to endure intense pressure to perform, often contending while competing in a culture that historically discourages them from seeking help for mental health concerns. Next is poor oral hygiene. Elite athletes have poor oral hygiene despite their efforts to take care of their teeth. In a recent study published in the British Dental Journal found that despite regular brushing and flossing, untreated tooth decay and gum inflammation was still prevalent among elite athletes because they often refuel with high-acid drinks. The study found nearly half of elite endurance athletes had untreated tooth decay and the majority of them had early signs of gum inflammations. The loss and decay are permanent. Add the sugar from sports drinks and gels to the mix and the risk to tooth enamel doubles. Common dental injuries in sports include tooth fracture, tooth intrusion, extrusion, and avulsions, and temporomandibular joint dislocation. All sports have some risk for dental injury, but contact sports like basketball and football presumably incur more risk. Oral facial injuries vary, but the most common are soft tissue injuries. The upper lip, maxilla, and central maxillary incisors are involved in up to 90% of all orofacial and dental trauma. The majority of dental trauma is tooth fracture, tooth avulsion, or tooth subluxation. Other factors, like oral candidiasis, is seen more likely in extremes of age, intraoral prosthetic devices, malnourished states, associated mucosal disorders, concurrent infections, antibiotics, and immunocompromised states. The most common type is the pseudomembranous type, which is thrush with white curd-like plaques that are easy to scrape off. The second most common type is the atrophic erythematous type, which usually involves the dorsum of the tongue. The third type is hyperplastic raised white plaques that can be scraped off only partially due to deeper infiltration into the underlying tissue. Well, how can the athletes manage their oral health? The first way that the athletes can manage their oral health is through health promotion, education, and behavior change. Oral health awareness should be prioritized at a multi-level approach, including athletes, trainers, performance support team, and national or international sports organization. Hence, the athletes will be concerned about their oral health based on what they drink and consume. In every dental appointment, they should explain their training routine and hydration regime with the dentist, so the dentist can record and detect early symptoms and give some preventive advice. The primary care providers can contribute in decreasing the oral facial injuries incidence by giving the injury prevention messages and recommending mouth guards. The second is dietary. Dietary intakes play an important role in oral diseases such as caries. Athletes should take less amount and reduce the frequency of carbohydrate and acidic food and beverage intake. These foods will be digested by oral microorganisms and cause caries to the teeth, and an acidic environment is a favorable condition for caries to happen. Bananas are a good choice for carbohydrate supply as they consist of minerals such as potassium, manganese, and magnesium, which will enhance the strength of tooth enamel. Foods rich in calcium and phosphates such as milk and cheese are able to remineralize the tooth enamel. Other than that, bicarbonate and calcium can also be added to drinks to reduce the erosive potential to the teeth. Sports drinks are essential for athletes to boost their energy. When making sports drink from powder, add an adequate amount of cold water to dilute it. Adding less amount of water as it should will increase the concentration of the sugar, which causes a more syrupy beverage that may harm your teeth. Besides, avoid prolonged holding or swishing sports drinks in the mouth, and using a straw to drink is recommended to reduce contact with teeth. The next is fluoride. Fluoride is a type of mineral that gives benefits to our teeth. Fluoride is commonly used in dental products such as toothpaste, lozenges, and mouth rinses. It helps to strengthen the tooth enamel and prevent cavities by promoting the remineralization process on the tooth surface. Fluoride may also slow down the loss of minerals from tooth enamel and prevent the growth of harmful oral bacteria. Fluoride toothpaste containing at least 1400 ppm is good enough to protect our teeth, but 5000 ppm is preferable. And the athletes also need to practice a good oral hygiene. Toothbrushing and interdental cleaning are effective daily dental mechanical plug removal. The athletes are advised to brush their teeth at least twice daily for 2 minutes using fluoride toothpaste. They also should brush their teeth at least 60 minutes after consuming sports drinks to restore the tooth surface from erosion. Specialized dental products such as neutralizing products, fluoride varnishes, gels or rinses, and mouthwashes may promote tooth remineralization, eradicate all microorganisms, and prevent tooth decay. Next is to reduce the risk factor. Tobacco use cessation is not only to restore health status, but also to reduce the risk of getting oral disease. Smoking habits may build up plaque and tartar on teeth, increase loss of bone within the jaw, and increase the risk of developing gum disease, leading to tooth loss. Smoking may disrupt the normal function of gum tissue and cause more susceptibility to infections such as periodontal disease. Hence, it may lead to gum bleeding. Other than that, athletes have to drink more water to avoid dehydration that causes a low salivary flow rate. Salivary flow rate is essential to prevent tooth decay, as saliva protects against mechanical, thermal, and chemical irritation. Saliva also neutralizes and cleans the acids produced by acidogenic microorganisms to protect the teeth from demineralization. The last one is protective equipment. They also need to wear a custom-made mouthguard when playing sports in order to protect teeth and oral structure from injury and soft tissue lacerations. Mouthguard should be fitted properly in athletes' mouths to make it more comfortable, resilient, not bulky, and enhance the effectiveness of protective effects when wearing it. Mouthguard's care should be taken seriously by cleaning it using cool water, mouth rinses, or toothpaste daily. Thus, it will minimize the saliva and bacteria buildup on it. Helmet and face shields are also important to protect the face and head and may reduce the traumatic incidents in contact sports when wearing it in a proper way. Let's move on by discussing the case. A 17-year-old male high school athlete who had numerous problems with decay in the last 3 years. The patient had excellent oral hygiene habits and was brushing twice daily as well as flossing daily. He also admitted that he consumes diet sodas and diet sports regularly due to his daily sports routine and stopped drinking everything else during the day. Though the patient had excellent oral hygiene habits, he had developed 4 new cavities as well as some other early lesions upon examination. During his first caries risk assessment, it was revealed that the risk factor he had was drinking liquids other than water more than 2 times daily. Other than that, the patient also had a caries screen score of 989. So the diagnosis is, due to the patient's unhealthy drinking habit, the regular bathing in the patient's teeth in acid and some sugars in the diet sports drinks were causing cavities. As treatment, the patient was advised to limit his diet soda intake and consume more water during his training. He also chose to be conservative with his home care program and changed his toothpaste with the dentist's recommended toothpaste that had 1.1% neutral sodium fluoride, pH neutralization, xylitol, and nanoparticles of hydroxyapatite for remineralization. That's all from us. Thank you very much.